One of the things that's important to understand, particularly when you go see a surgeon, is what is it that the surgeon considers a good result? What their expected outcome may not match with what you're expecting out of the surgery. So when it comes to tummy tucks or body lifts, which each week I probably perform somewhere between 5 and 10, depending on the week, whether it be a combination of tummy tucks or body lifts, there are really three things that I'm looking at. One is I really want to make sure that incision is nice and low and even. And the reason why is it just allows us to hide our incision in the panty line. And the second thing is the look of the belly button, which is a very common question I get is, how do you design a good belly button? Well, that's a good question. It depends a lot on the patient characteristics. So there are some patients that have the propensity to have a little bit of a different looking belly button. But in general, the way to get a good belly button is involved in two aspects. One is how you cut the belly button out when you're doing the original or the initial dissection for the tummy tuck. And then more importantly, how you design the hole that you pull the belly button through and secure to create that new belly button. So in my practice, I do a more of an elliptical shape. I think the oval shape looks very unnatural, tends to show a higher scarring pattern. Patients that have hernias before surgery can be a little bit higher risk to need a belly button revision. But in our practice, I think, out of, let's say 100 tummy tucks, I maybe have to revise one or two of them, maybe because of a little bit of excess scarring on the edge, which is really quite simple. We just do that in the office. So in order to create a really good belly button, it's all about the technique and how you remove it and then how you inset it or how you put it back together. And again, I encourage you to look at our website and critique. Go look at, you can magnify in on all the different belly buttons and see, and hopefully you find one that you like. But I think that's a very big differentiator between a well-trained body contouring surgeon and someone that does a lot of tummy tucks versus someone that's just a weekend warrior.